Each year, almost 800,000 people have a stroke, and unfortunately, more than 140,000 people will die, making stroke a leading cause of death in the U.S., as well as long-term disability. We spoke with Dr. Ken Wogensen of Methodist Hospital in Arcadia about the symptoms to be alert for and the immediate response that's necessary to prevent serious long-term effects or death.
Well, we have a time frame for treatment of what we call the ischemic strokes, that is, the strokes from plugs, where there's an interruption of the blood flow to the brain. Our goal is to restore blood flow to the brain to minimize or totally eliminate the stroke signs and symptoms. We like to work with our special agent, which is the most powerful blood thinner we have, called TPA, or tissue plasminogen activator. And its purpose really is to dissolve the blood clot and restore the blood flow. Now, what we'd like to do is we work on what's called the last known well. That's the last time you were feeling fine, and we want to know what time that was, assuming that the stroke then occurred. We'd like to get you the medicine within 3 hours, ideally, of your last known well before you had any signs or symptoms of the stroke. If a patient identifies themselves, or a family identifies the patient as having a potential stroke, we'd like the paramedics called immediately so that the patient will be transported to a center, a stroke center that's set up and ready to go to take care of the patients to make the diagnosis. Our evaluations at the stroke centers include getting blood tests, we're getting a CAT scan, and we're going over the clinical history with the patient to determine the last known well and to see how the signs and symptoms are progressing. So in addition to the verbal talking, we do a neurological examination to check for signs and symptoms of stroke, problems swallowing, problems speaking. This is all part of our evaluation. We divide the strokes into those that we call wet versus dry. If you're having a hemorrhage, that's a different treatment path. If you're having a dry stroke, which is a plug, we try to relieve the plug, restore blood flow to the brain. The first thing we consider for all of our patients who are in with an infarct or potential dry stroke is TPA to reopen the blood flow to the brain. Now, if you're a TPA candidate, which means we've done your CAT scan, we've checked your blood parameters, we've done a history, you're well within what we call the 3-hour window for treatment. It takes about an hour for the entire TPA to be infused in through the arm. And then for 24 hours, they're watched in the intensive care unit. We keep a very close eye on their blood pressure, their pulse, their blood sugars, and all their signs and symptoms. I find a particular satisfaction as a neurologist and as a stroke doctor in giving people their lives back, giving people a second chance.
Dr. Wogensen tells us about the early warning signs of a stroke.
They can start with some slurred speech, some weakness, some numbness, some dizziness, some lack of coordination. The idea with a stroke is it sometimes starts small, but oftentimes will grow in size and intensity. So if there's a family history of early stroke, you have to ask why. Is it because there's a family history of atrial fibrillation or irregular heartbeats? Then if so, you need to be watching very carefully to see if you're going to develop the same problem. If so, get treated so that it doesn't lead to a premature stroke.
Dr. Wogensen gives us his best advice about stroke.
I also like to encourage people to adopt what we call the Mediterranean diet. A lot of fresh vegetables and fruits. A lot of chicken and fish, a little bit of meat, but not too much. Regular walking, regular exercise is a great way to prevent strokes from happening in the first place. People say anywhere from half an hour to 40 minutes of regular exercise every day. Have a good working relationship with your primary care physician so that you will go in on a regular basis and get your weight checked, get your blood pressure checked, get your blood sugars checked, get checked for signs or symptoms of atrial fibrillation or irregular heartbeats.